Alrighty, thank you everyone for joining us in whatever time zone it is for you at this moment in time. My name is Jason Onesto. I am the Assistant Director of New Student Programs here at the university. A couple of housekeeping things, excuse me, that just to get us started. We are joined by Dr. Vaughan today, who's going to talk with us a little bit about pre-health studies, and I will let himself introduce himself here in just a second. Just for your information, we will have a portion at the end of the presentation to answer any questions you may have. You'll notice there's a little box at the bottom of your screen with a Q&A emblem on it. We encourage you to use that throughout the presentation if for some reason you would like to ask your questions as we go. Otherwise, we'll be able to answer those in person at the end of our time together this evening. Without further ado, I'm going to hand things over to Dr. Vaughn.
Hello, everyone, and thanks for attending this session on Pre-Health Studies program. I am Dr. Vaughan, a member of the biology department at Richmond. I serve as the primary pre-health advisor on campus and oversee all the resources for the program. At the start of the semester, I will be holding a more formal orientation meeting for new students in which I will be covering the program's resources in great detail. But with registration for fall courses approaching, my main focus tonight is to share some general information on the Pre-Health Studies program and provide some guidance regarding choosing your fall courses. And since we are in a webinar format this evening, I cannot see or hear you, but I will be able to see any questions you submit using the Q&A function, the chat at the bottom of your screen. So feel free to use that feature throughout the slides that I'm going to be going through, and I will try to watch out for your questions. Okay, so I'd like to begin by clarifying what pre-health studies is and what it is not, because this is sometimes a point of confusion for new students. Pre-health studies is a program that supports all pre-health students at Richmond, and by pre-health, I mean students who are pursuing any kind of health profession career. And I underline the words all students and any kind of health profession because sometimes students think that I only work with persons who are pursuing medical school and forget about the entire spectrum of healthcare professions that are out there. That's not the case. So any healthcare field you can imagine you might want to go into, I would be glad to help you reach that point. The ones that are listed on this slide are ones that Richmond students tend to gravitate toward, shown on this donut chart. And you're looking at data from our students who applied to start health profession school in 2024. You can see by the darker blue color that slightly more than half of our pre-health students applied to medical school, with the remainder being divided among physician assistant, dentistry, physical and occupational therapy, pharmacy, and nursing. A second aspect I want to emphasize is that you can be part of the pre-health studies program regardless of what your major is. You can see from this list of academic majors that last year's applicants they were a diverse group. Their interests included, majors in the humanities, the social sciences. We even had some students from the business school and leadership studies schools who were on a pre-health path that I worked with and who applied this past year. So you should really be looking at majors that interest you the most academically, and the pre-health coursework we can work in regardless of what major you're thinking about. Note that one thing you don't see on this list of majors, though, is pre-health studies, which brings me to the next slide, and that is what pre-health studies is not. Okay, so first of all, it is not an academic major. That is to say, you cannot simply package together the courses you need to take for health profession school and call it a major, right? So think of the program instead as a resource. Also under this what it is not category, pre-health studies is not the same thing as health studies, which is an academic program that you can choose as either a major or a minor. And sometimes health studies is confused with pre-health studies, partly because a good number of pre-health students take coursework in that program, But pre-health studies and health studies are actually entirely separate entities. Okay. Uh, by the way, if you're interested in learning more about the health studies program, I would certainly encourage you to visit their webpage. The health studies curriculum covers important topics that will most definitely impact your work as a future health professional. There is a lot of emphasis on that program on learning about the healthcare delivery system in the United States. So it's a much uh, more zoomed out view than what you would experience just thinking about the interaction that might happen in an exam room between a provider and a patient. There's also focus on healthcare policy, health economics, uh, big emphasis on public health. So those might be areas you're considering or thinking about. I would definitely encourage you to take a visit to their webpage and check it out. One of the main aspects of the pre-health studies program is pre-professional advising. And as I mentioned earlier, I am the main health professions advisor on campus. So I help students plan out their curricular and extracurricular activities, taking into consideration their intended degree program, what they're majoring in, minoring in, that sort of thing, while also ensuring they are positioning themselves to be competitive professional school applicants later on. During that application year to professional school, I'm helping students navigate the process through workshops that I lead. We cover everything from how to complete common applications for professional schools, which are quite different than the one you might have recently completed for college, uh, personal statement writing, preparation for interviews at schools, choosing which schools to apply to, that sort of thing. I'm also connecting our students who are going to be applicants with alumni from Richmond who are enrolled in various health profession programs that they might be considering, as well as connecting them with practitioners out in the community and really across the nation. We have spiders who are healthcare practitioners throughout the US and have a pretty good LinkedIn network going there. Um, for each of the semesters that you are at Richmond, you will have an assigned academic advisor. And for most of them, that will be someone who is, after you've declared your major, a person within that department. Uh, but I would be with you in terms of pre-health throughout your entire journey at Richmond. So your primary academic advisor may change going from first year to second year, especially if you're declaring a major at that point. But I would still be with you helping with course selections and planning out your semesters. Okay, so you can think of me as a secondary advisor throughout the process. Um, there are also multiple curricular tracks within health studies. You will find those listed on the grad tracker system when you go to create what if scenarios with your schedules. You'll see options. They're listed with the majors on campus, but they're not actually majors. We just put them in there so you would be able to choose that track as an accessory to a major, and you can see the courses populate there in your grad track review. Okay. So now that I've given you kind of an introduction to pre-L studies, what it is not, a little bit about advising, wanted to turn my attention to summer registration for your fall courses. And as you may be wondering, what courses you should be thinking about taking in your first semester at Richmond, I have a couple of slides here on that to kind of go over some basic points. First of all is that the pre-L tracks require a good number of science courses, as you might imagine, and many of these courses are set up in sequences where you take one course before you do the next course because it's a prerequisite and it's like a domino effect in terms of lining up your courses. And that's particularly true with regard to chemistry. And for most students, that course, the Chem 141 General Chemistry course, should be your kind of starting point for the pre-health path. Okay. And that is because not only of the sequencing, but also because when your second biology course that you would be taking at Richmond requires the Chem 141 anyway, so it makes sense to get that done early on. Okay. A couple of exceptions that I would mention here to consider in terms of maybe postponing Chem 141 would be if you're looking at a physics major, in which case you would take our introductory physics course in the fall semester. And if you have chosen to participate in the SMART program, uh, where you're taking essentially an integrated biology and chemistry course in the fall in lieu of the Chem 141, but you're getting that same material content-wise from the Chem 141 class. Second point about fall schedule is that if you are considering biology for a major or biochemistry and molecular biology, also known as B&B, and how I have it designated on this slide, you might consider taking our introductory biology course, which is Biology 199, along with your Chemistry 141 class. Okay. And the exception here would be, again, if you're looking at the SMART program, because it integrates the biology and the chemistry together, you wouldn't need to take the Biology 199. That would be duplicative. And then the second thing to mention here is that if you have a lot of extracurricular commitments that you're anticipating, maybe you're involved in athletics that has a heavy time component, or if you're doing something like the Bonner Scholars Program and you have, certain hours that you need to meet for that, then you might need to be a little bit more cautious about how many science courses you're taking right off the bat starting out. Okay. Generally speaking, I would advise not taking 2 science courses plus calculus. That's a pretty heavy combination to start with. And I certainly would not recommend doing 3 science courses in combination really at any point during your time here if you can possibly avoid it. And there really isn't any reason you would need to do that. So standard load, we would say, for pre-health would be 2 sciences per semester. But again, transition to college, you might want to be a little bit more cautious and start with 1. Let's see, a final point I wanted to make regarding courses for fall semester has to do with considerations for AP or IB course credits that you may have. If you visit the New Spiders webpage, you will find this chart that shows how University of Richmond awards credit based on AP and IB test scores. And the chart includes biology, chemistry. Physics is not included because it's off screen, but physics is on there, believe me. And as you review this chart, in terms of thinking about pre-health scheduling, you have to be particularly mindful with the science courses, since those are the ones that the professional schools are most concerned about in their admissions process. So if you look at biology, calculus, pretty much any non-science, and usually physics, those are all courses that you don't run into any issues typically with using AP or IB credit in terms of professional school admissions requirements. They're generally flexible enough that they could consider those as being satisfied on their end for their admissions prereqs. In my experience, the course that is most likely to cause an issue in terms of professional schools would be the chemistry. And remember that we will give you credit if you have AP or IB chemistry course score that's high enough. We will give you credit for our Chemistry 141 class, the one I was mentioning earlier. But just because Richmond gives that credit doesn't automatically mean that the medical school is going to be okay with that or going to accept that toward their requirements. And so for the chemistry, what I generally advise, since there is variability from med school to med school on this, is not using the credit unless you plan to take more advanced chemistry coursework than is required for your typical pre-health path. So if you're looking at either a major or a minor in chemistry, or a major in biochemistry and molecular biology, where we know you would be taking higher level chemistry courses, and those could substitute for the AP in the event that you apply to a school later on that doesn't accept AP chemistry or IB chemistry. then that's the safest approach for that. Otherwise, you might find that once you get 3 or 4 years down the road and you're in the application process, that the school that you really want to go to says, "Sorry, we don't take AP or IB Chem," and then you have to take an extra chemistry course at Richmond at that point. Okay. This is a chart that you might have seen if you have visited the Pre-Health Studies webpage, and I'll be emailing this chart out to everyone. But it basically goes through all of the common pre-health tracks that our students follow, and it gives you the common admissions prerequisites for those, and then parenthetically, the corresponding classes at Richmond that satisfy those particular requirements. Okay. Um, I will be sending out an email on Friday, this coming Friday, to all of the students who indicated on their common application that they were interested in a health profession career or pre-health as an area of interest. I think the Common App allows you to designate a couple of different areas of interest. So anyone who designated that on the Common App will automatically be on my email list. If you are not sure if you did that, or you want to just make for certain that you're on my list, then this particular QR code, if you would like to go to the web page that's linked to that, it's a form, a brief form on Google that you can complete, essentially an intake form for the Pre-Health Studies program. And then I can capture your email from that and be sure that you get the message that goes out on Friday. Okay. I've also listed my contact information, email and phone on here. Feel free to use that, either of those as a means of reaching out to me at any point, that you have questions related to the program. The primary take-home message that I wanted to leave you with tonight is that the Pre-Health Studies program will really support you along your journey toward health profession school. I'm very accessible to students, and so feel free again to reach out anytime you have questions or need assistance, because I'm here to help. And I will stop at this point. I don't see any questions in the chat yet, but I will stop and see if there's anyone who wants to raise a question.
There's one for you, Dr. Vaughan. We've got, is doing pre-health and smart simultaneously recommended?
Sure. We have a good number of students who do that combination. It really doesn't change much in terms of your preparation process, certainly, because the SMART coursework, it's a 2 semester long sequence. And so you're getting the same number of contact hours essentially for biology and chemistry. The difference with SMART is that it's integrated, so the biology and the chemistry occur in the same course, whereas with the traditional curriculum, you're taking a separate chemistry and biology course, right? So one semester you do chem, the other semester you do biology. SMART just kind of, covers both at the same time. So no problem at all doing the SMART program on pre-health track.
What other questions do we have? Got another question. Is it hard taking one science subject and calculus at the first semester?
I would say that combination is reasonable. If you find that you really struggle with math and anticipate that you would have to put a significant amount of work into a calculus course, then that could be a reason maybe just to push it off until the second semester. I will say in terms of the pre-health path, there's no rush to take calculus, right? Because most of the health profession schools don't even require that course, right? So, and even with the traditional pre-med coursework, the earliest you would need to take calculus for something like physics would be probably end of your second year, maybe. Um, so there's no problem, if you want to delay the calculus, but if you're coming right out of a calculus experience in high school where it's fresh in your mind, then, rolling right into it first semester of college might be a reasonable plan. And I can tell you in terms of the starting courses for biology and chemistry, Chemistry 141 is very similar to an honors or AP chemistry in terms of the topics that are covered. And the Biology 199 course is a very different kind of science. That's why we don't give AP or IB credit for it. It focuses on the scientific method and how scientists approach their work. So you learn a lot about scientific writing and how to read scientific papers and how do you set up scientific experiments and test hypotheses. So it's that kind of a course. There is a lab, yes, that's associated with it, but it's not a content heavy course like you might have had with like AP biology, for example.
We'll give a couple more minutes for any outstanding questions that we may have. All right. Well, I'm going to go ahead and start closing us out. Thank you so much, Dr. Vaughan, for joining us today. If for some reason you have any questions, Dr. Vaughan has listed his contact information right there on your screen. Otherwise, you can contact me from the email that I shared with you all just before this webinar started, and I'll be more than happy to answer any questions you have regarding your orientation process or anything you have coming up for this summer. Thank you so much for joining us, and I hope that you have a wonderful rest of your day. Thank you.
Good night, everyone.